Thank you for joining me for another episode of the Longevity Blueprint podcast. The topic for today is Beyond the Snap, Crackle, Pop. And my guest today is Dr. Calla Jayne Kleene. She goes by CJ, so I may be calling her that through this podcast. I'm super excited to have her on because she is a wonderful friend who actually wrote the foreword on my book, Your Longevity Blueprint. And chapter 2, if you haven't read it, you should read it, is all about musculoskeletal and nervous system health. And this is a section of the book where I highlight chiropractic care and all of what it has done for me. I am a huge believer, huge fan of chiropractic care. I see CJ. And naturally, I wanted to have her on the show. So welcome, Dr. Calla Jayne Kleene. Thank you for being here.
Thank you for having me.
So tell me a little bit about what chiropractic care is and what you do.
Yeah, so chiropractic care is this wonderful study of health there's a phrase called above, down, inside out in the chiropractic jargon. And we believe health comes from within, and God created our body to heal itself. We sweat when we're hot, we shiver when we're cold, and we just have these innate abilities that we believe with chiropractic and staying in the line that it just helps optimal function from a variety of parameters, really from a whole system, whole body approach. We help treat patients, relieve pain, relieve ailments without the use of drugs. We use our hands, and we use some various tools that allow us to uniquely treat each and every individual patient.
Wonderful. Well, we titled this podcast Beyond the Snap, Crackle, Pop because I think some individuals have a minimalist perspective on what chiropractic care really can do for them. But I want to address the snap, crackle, pop. So first, what is happening when you get adjusted and you hear that popping sound? It can kind of be scary. So what's happening?
Yeah. A lot of people are terrified of that, or they've seen a crazy YouTube video. I mean, I've seen some of these videos and they terrify me. So, and it doesn't have to be, chiropractic has this big range of very low velocity, low force to crazy, what I would even consider, it looks traumatic. So a big range of how we can treat our patients, but a lot of the times the snap or the crackle, I personally like receiving it as a patient, but it's called a cavitation, and really is what it is when we put pressure on those joint spaces in the spine. It's a cavitation. It's a release of pressure. It's a release of oxygen, nitrogen, and carbon dioxide. So that's why a lot of people are like, oh my gosh, I just have this great euphoric feeling post-adjustment. It's that release of pressure that's been building up in the spine. Same thing happens when we crack our knuckles.
Yeah.
It's just not as specific that we as chiropractors like to treat when we treat the spine.
Well, I like that. It can be kind of scary when you hear lots of pops, but I just feel this release. I feel better.
Yeah. And they've studied, I didn't mean to interrupt you, but they study that, just the endorphin release post-adjustment that gives you that euphoria. But again, not every time do we need to necessarily hear that cavitation, the nice crack. There's been times when I'm adjusting patients and I can feel it move, but it doesn't give you that, it's kind of, for me as a chiropractor, it's wildly satisfying to hear that. But I would also encourage patients, if that's been one of the things that's holding them back. My sister-in-law, she lives in Washington State, and even when she hears strangers cracking their knuckles, it makes her entire body just get the chills. She just hates the sound of it. Well, for her sake, I don't want to say, hey, then don't go to a chiropractor. Just find a chiropractor who does low force that you don't necessarily have to hear those snaps and the crackles. But again, I love it. I love delivering that for patients, but chiropractic shouldn't be a one size fits all. You talk about this in your book that, your approach to functional medicine is very far from a cookie cutter approach, and it has to be down to the individual.
So I'm sure it is very affirming and satisfying when you hear that. But expand on what you just mentioned. You said there are different chiropractors with different techniques. So what's the low? You mentioned a low
force.
Low force. What is that? What is that?
Yeah. So it's one of those things that I can't speak to the volume because I don't practice it on a daily basis.
Sure.
But there is, so in the chiropractic realm, it can be hyper specialized based on the technique that the chiropractor likes to deliver. Typically, we're all biased. What we do and practice day in and day out, we think it's the best. In my honest opinion, it's not the best for everyone. One of my really good friends, she was coming into me and her muscles were really tight and ragged, and I work on a lot of muscles. And she would tell me, she's like, hey, every day I feel great after I leave your office, but the next day I feel like kind of like I got a chiropractic hangover. And I was like, whoa, time out. I've
I've
been
never
seeing you
heard
for
that.
over, yeah, I had never really heard of it either, but that's how she described it. And I was like, well, that's no fun. You didn't have the party last night to feel this awful today. And so I encourage her to go down the road to a friend of mine who practices a very low force. So typically, like, again, back to this range, if we have very gentle, and when I talk gentle, some people might think, did they even do anything? They just laid their hands on my body. I barely even felt any force. For some people, it's really powerful and really profound. So she started to go with this low force chiropractor, and there's a lot of techniques in that realm. Activator is one of the more common ones, that it's like a little clicker. And even that setting can have from a very low force to a, stronger force. But compared to what I do on a scale of 0 to 10, like 0 being like the most gentle, like puff of air force, compared to some of these YouTube videos where it looks like they're getting Jackie Chan, if you will. I'm probably like a 5, 6, 7 kind of range, but low force, again, just very, very gentle. And it can be very specific. And again, my friend, she in town, she gets like the deepest massage therapist to just beat the heck out of her muscles. But from a chiropractic perspective, her body responds so much quicker, faster, and she holds her therapies so much longer on that lower force chiropractic.
I think that's one of the things that I respect about you the most, is that you know when to refer patients out. And I want to get more to that later, but I want to come back to my book, because in chapter 2, I mention a quote. I actually open every chapter with a quote. And BJ Palmer, who he started the Palmer School of Chiropractic. Is
He's
that
the
correct?
second generation. Dee Dee Palmer started it, and he's the son of Dee Dee Palmer.
Got it. And we live in Iowa, and that's where this chiropractic college is. So I have to shout out to, we're both from Iowa. I have to shout out to Palmer. And that's where you went, correct? For school?
Yes.
Yes. So the
Yep.
quote that I mentioned in the book is that medicine is the study of disease and what causes man to die, and chiropractic is the study of health and what causes man to live. And I think that is so true because many times with medicine, I feel like we're just prescribing a pill for an ill. And with chiropractic care, I feel like that's what's, like you mentioned, helping release the nitric oxide and energizing us and really helping support all of our organ systems. And I know I previously had I was in a very stressed state. My nervous system, it was just in that fight or flight state, and I needed to go to the chiropractor very frequently. I can stretch my appointments out a little further now, but I felt so just jazzed up, and I needed to get adjusted to help calm down my nervous system. So that's just one example, one testimony of how I've benefited from chiropractic care. I truly believe in this care. I almost went to chiropractic school myself, and I ended up going down the nurse practitioner route, which is great because now I do have the option of integrating or combining, natural medicine with conventional medicine, and working with providers like you who provide, I guess we would call it more alternative care, but we need to offer our patients all of these options, because I think that gives them the best of all worlds combined that can help them live a better life, a healthier life. So I believe that all my patients should be seeing a chiropractor, and I'm not even a chiropractor. So what do you think? What would you say to someone who thinks they don't need chiropractic care? Like, I wasn't having joint pains or muscle pains. I was just stressed out. My nervous system was in this fight or flight state. And that's how I personally benefited. I didn't have an acute injury or back pain, whatnot. So what would you say to someone who thinks they may not need chiropractic care? Or maybe not everyone needs it. What's your opinion on that?
Yeah, I think at any stage in the game of life, from the littlest of babies to geriatric population, everybody can benefit. But again, like you said, you came in and you didn't necessarily had pain. You just, from an energy standpoint, you felt that there was an energy block. And so when we look at our nervous system, we have the parasympathetic, rest and digest and fight or flight. So parasympathetic, sympathetic, and they go back and forth. So a lot of times it's just the reset that we adjust in that mid back, that T-spine, and it just kind of helps the system reset, if you will. But back to, I think, does everybody, yeah, my yogis, my really disciplined patients that practice yoga, that are very strong, but also flexible, they rarely need to come in. They are honoring their body. They're putting it through movements and motions. I mean, personally, I've walked into a yoga class feeling that I've needed an adjustment, and I spend the time and work on my body, and I walk out and like, I freed that up, that I was able to do on my own. But I know some of my manual labor workers, they put a lot of wear and tear on their body, or our endurance athletes and triathletes, they literally physically are putting more miles on their body. Personally, I do feel when they come in, we see the joint restrictions, we see the muscle tension, they need to get adjusted a little bit more frequently. So it really, again, comes back down to the individual on what does their treatment plan look like.
Sure.
I have a person I hadn't seen in 3 years pop in the other day, just kinked their neck, doing something, nothing impressive, but they kinked their neck. And I teased him. I said, hey, I'll see you again in 3 years when you feel like you need it. But my husband, I always love telling this story of how he got introduced to chiropractic. I was in chiropractic school and I said, hey, I need you to get adjusted. And he looked at me and he goes, I have no back pain, no neck pain. And I said, babe, if you want this to work out, you're going to get adjusted. And he was terrified. I said, what are you worried about? And he goes, well, once you start going to chiropractor, you have to go for the rest of your life. Mm-hmm. And I kind of had to sit with that for a little bit. And I'm like, it was such a good point. And I see his point on two sides. I mean, a lot of times there are crooks in the chiropractic field. There's crooks in any healthcare field, in any profession, that they say, I want you to come once a week for the rest of your life and give me $5,000 up front. And this is not everybody. I'm not trying to say, there's a lot of us, but they do exist. And then, on the other side of that, Tyler is a perfect example. He didn't know how good he could feel. And, he said right after he got adjusted, he's like, I didn't know my neck could move like that. And then, then the next morning, he was like, I didn't know I could sleep that good and that hard. And he didn't know what he'd been missing out. So it's kind of cool that I've seen him morph into a better understanding, a better connection to his body, because he just didn't know. So I always encourage people like, hey, give it a shot. Don't wait necessarily until you have pain. Usually that's what drives people to come see you, that there's, in your case, what I witness is that people, you have two different types of patients. One, the patient who's tried everything, the traditional medical models failed them, and they're like, I'm willing to do whatever it takes, help me. And then there's other patients that come to you that they just align with, I want to figure out what's wrong, and I want the data and the labs to show me what it is I need. I don't want to just go to the doctor and they tell me, oh, it sounds like you have depression. I have nothing to be depressed about, but I do feel depressed.
Sure.
And so you are their investigator and say, hey, let's dig into this and let's get to the uniqueness of you. Similar with chiropractic, it's just, you don't have to necessarily wait until there's an ailment, but really kind of do the research and find a chiropractor. Ask your friends, who do you trust? Who have you been to? Who do you feel has good ethics and good integrity? If I don't feel like I have pain or an ailment, I need to connect with somebody to, be another portal of a team player of the total health package.
I like that, total health package. In my book, I talk a lot about building a healthier body. And so the second step in building a healthier body, I believe, is seeing a chiropractor, getting your joints and your muscles and your spine, everything in line so that your other organ systems can work effectively. So let's go back to what an adjustment is. Can you tell me, if someone comes into your office, so when you're offering, is it called a manipulation, or how do you treat a patient? And then we'll talk about, other than the adjustments, some other modalities you offer in your office. You're kind of a triple threat. You offer so much, but let's focus on what an adjustment or manipulation is. So since you said on the degree of severity, from 0 to 10, you're more of a 5, 6, 7. So if someone has never been to a chiropractor before, what is an adjustment? What can they expect?
Yeah. So it really, again, depends on the type of chiropractor that they see for their first visit. There's a couple different types or varying degrees of chiropractor. So when I was in chiropractic schools, like you said, I went to Davenport, Palmer College in Iowa. It's where chiropractic started in 1895. It was the same year X-ray was founded. But very traditional chiropractors, who I have some of my best friends in the chiropractic world practice very traditionally, where I practice on the opposite end of the spectrum. So in our lingo, we call it a traditionalist, a straight chiropractor, or what I am is a mixer. And I'd always joke in school that I'm a dirtiest mixer and I love it all. So nutrition, we call it thoughts, traumas, toxins, and yes. I like to address all of them. With it. So I'll speak to that, but I really want to honor the traditionalist chiropractors. It's what led me to chiropractic school in some respects. That you go in, you get an X-ray, you get an analysis, very specific analysis on the X-ray where we look for degrees of rotation, laterality, and it's a really cool evaluation when we do look at those X-rays. And then they develop a treatment plan based on those X-rays.
Because you want your spine to be in line, right? I mean, you want your spine, you don't want, you want your spine to be in line on that X-ray, right? So you're looking for a general person who doesn't have a lot of training in the medical field. You don't want any of those vertebrae to be, shifted to the side, whatnot, because that can impinge a nerve and cause pain. So you're looking for any abnormalities on that X-ray.
Yep. And those chiropractors, so Dr. Gonstead, he developed a method, and they run like a nervoscope up and down the spine, and this nervoscope detects temperature differences. So again, it's more diagnostics for the clinician at the time that the patient comes in, where when they see that there's a subluxation based on the X-ray analysis, and then they see a temperature difference, that's when they know to adjust when and where the opposite kind of end of the spectrum on how I practice is based on motion, based on muscle tension. The Gonstead or the straight chiropractors, they do motion analysis too, but again, they go back to where do they see the subluxation on the X-ray. Again, because some of the stuff that we do, we conflict, but where I'm at as a chiropractor doesn't mean that mine is the best and theirs is the worst and vice versa. Every patient has to find and navigate what works well for them. And build a relationship. I'm really big on like, do you trust this person? Do you have a relationship with them? It's a very intimate relationship. We touch our patients every single day. During all this coronavirus stuff, a lot of people are really terrified. And one of the things I'm so grateful is I still get to physically touch my patients.
Yeah.
Which I think is really important. I had a patient come in. He was sitting at his work desk and had his feet up on the desk, and the phone rang and it startled him, and he like jumped up and felt a huge pop and an intense amount of pain. And they had to drag him to the hospital, and because he was in so much pain, and it was probably, I think, 10 or 11 o'clock at night. So I wasn't open. And the next day, his poor wife is carrying him in, and they're like, we got muscle relaxers and pain pills and we're dying. We need to figure something out. I lay him face down on the table and I lift up his shirt. I wanted to see what his back looked like. And he's got 3 perfect black and blue spots, and it looks right where his transverse processes should be. And I said, did they x-ray your back? And he kind of looks at me and his wife and he goes, they didn't even touch me. So from an evaluation standpoint, to not even touch.
Quick to prescribe the painkillers without any physical assessment.
Yeah, and he was visible. I mean, honestly, I'm kind of glad they prescribed him. He was in so much pain, but it's because he literally had 3 fractures in his spine. And so it's just one of those things, like I feel very fortunate we get to touch our patients. So anyway, I don't mean to tangent there, but I do it more basic. Oh, go ahead. Yeah, so the motion palpation. So I want to assess the motion through active range of motion, and then through static palpation when they're laying face down on the table, and find where those joint restrictions are. I have a lot of great colleagues that think that that's reckless. They don't like that I don't take an x-ray before I adjust a patient, but we listen to the health history. We make sure that there's nothing alarming that would indicate, hey, before I adjust, like that patient that I just mentioned who had the 3 avulsion fractures, he was so symptomatic that I'm like, I am so sorry to do this, but I should not treat you until we get a look at that x-ray so we know what we're dealing with. I had a roofer who he fell off the roof and landed on his feet. And 4 days later, he's in my office with just massive pain, but I didn't like the sound of it. And he had a compression fracture in his spine. So we do our due diligence. When x-ray is definitely matches the health history, we'll run that x-ray. And we have good results. If we didn't have good results, we wouldn't still be in practice today. So
right.
There's so many different ways that we can evaluate the spine. So again, it just comes back down to the provider and the chiropractor's training and just the techniques that they provide.
You have the skills, it sounds like, to obviously palpate your patient and determine where they need that adjustment, but the wisdom to send them for an x-ray if needed. Something that you've mentioned to me multiple times, what's the saying that you say, there's 500 chiropractors, 500 different.
The great thing about chiropractic, there's over 200 techniques and philosophies out there. The bad thing about chiropractic, there's over 200 techniques and philosophies out there.
The good and the bad.
Yeah.
Well, beyond.
Yeah,
I was going to say, beyond getting an adjustment, I think what partially is helped us, I think, become such good friends. We just have a similar way of thinking. You offer more than the snap crackle pop, and that's again kind of why I titled the podcast this. That's so important, and I want to hear that that snap crackle pop. But what do you offer in your office beyond the adjustment? I think that really strengthens the care you can provide to your patient. So what else do you offer there? What other tools and techniques do you have?
Yeah, so beyond the snap crackle pop, which again, that's like my backbone, literally. It's my foundation of how I became a healthcare provider. And again, you were the one that really introduced me to a whole another set of tools from the functional medicine standpoint. But as it pertains to musculoskeletal care, I do a technique called active release technique. It's really an assessment of the muscles, releasing a lot of the adhesions and trigger points that we can develop in between nerves and muscles. So when we look to the spine, about 80% of our body's musculature attaches to the spine in one way or another. So basically, shoulder down, we have 80% of our musculature in our torso that is responsible for so much of our motion, attaches back to the spine. So our goal is that if we can treat the muscle, ligament, tendon, nerve at the same time we treat the bone, our bias is that we feel better quicker and then hopefully stay and maintain that adjustment longer. I always tell my patients they have better things to be doing than sitting in my office all the time. And my ego, our ego is like, we want to get our patients better and fast and back and, doing their normal routines and not having to rely on us from the acute care. I love wellness patients. Like when you come in, it's like, oh my gosh, I love it. I check your spine, I adjust you, and, we catch up and you're on your way. Like that's actually my favorite. But so much of our patients, they come in when there's an ailment. Hey, I'm having headaches, I'm having migraines, I'm having back pain. So much of us, when we work with insurance companies, to be medically necessary, it has to have a musculoskeletal pain, a discomfort, a numbness, a tingling. So in that realm, that's like what we call like the evidence-based chiropractic. Now, I have some patients that come to me only when they're constipated. Like, CJ, I have zero back pain, but I'm constipated. When we look at, L4, L5, S1, and we look how those nerves that leave that area of the spine has so much control over our reproductive organs and that lower GI, we adjust their spine when they're out and their bowels get moving. Pediatric chiropractic.
Really, joke with some of
yeah.
Is the post-chiro poop when you take your little one to the chiropractor. So if your child is constipated and you've tried many things, prunes, whatnot, magnesium, obviously water and a belly massage, take them to the chiropractor. That may help facilitate it.
Yeah. Well, and I think what you and I get to see in practice is we have some very diligent patients who've taken their kids to the chiropractor and they've done their work on saying, okay, I've done the chiropractic thing, but they're still constipated or they're still bedwetting. What am I missing? And I think that's where you bring in so much from the functional medicine realm of, let's look at this as a food allergy or food sensitivity. They're not digesting properly. So back to kind of the chiropractic, blueprint, if you will, thoughts, traumas, toxins, we can address some of the trauma to the spine, but if we're not hitting something that's toxic to them, like maybe milk or gluten, or even something like a banana, we've had kids come back with banana allergies or food intolerances, which really then can have a drastic effect. So chicken or the egg, is that banana or dairy allergy creating the subluxation in their spine, or is that spinal subluxation creating the inflammatory response to the food sensitivity?
Right. We don't know, but let's treat them both. Yeah, totally. Yeah. Go back to that active release technique. So when you are adjusting patients, especially if they don't maybe hold their adjustment well, and correct me if I'm wrong here, but is offering that therapy, that active release technique, more going to help them hold their adjustment better because you're addressing the muscles and the spine at the same time?
Yeah. And, some of my patients, we get some referrals from the medical community, and some of our patients are terrified, and some of their medical providers are terrified of the cervical manipulation. So we'll get a referral and they'll say, no manipulation of the spine or of the cervical spine, which we honor that. We always have the discussion with the patient, and there's been a couple instances where I'm like, oh my gosh, the main part of this is that, that C1 vertebrae is so far out of alignment. If I don't treat it, I'm only treating the patient 50% by just doing the ART. So I don't want to minimize the adjustment when it's necessary, but it's about respecting boundaries of patient preference.
Sure.
And I'll pick up the phone and call the provider and say, hey, why are you concerned about this? And sometimes that dialogue is like, hey, there's a family history of vascular patency where they're, having an abdominal aortic aneurysm, which is very scary. So they don't want rotation of that spine. Sure. And that's a very valid concern. I think chiropractors should be talking about this a lot more, about knowing when to adjust and knowing when not to adjust. So we'll get some patients that have significant rotation injuries, significant rotation restrictions. So this kind of range of motion, but they're terrified of the adjustment. So I've been able to fully restore functional range of motion with just doing ART and not even manipulating the spine. So that's kind of nice in my realm of, I have multiple tools that I don't, if for some reason it's contraindicated to adjust the patient, we can do the ART. Another technique I do is Graston, which we call it the shiny butter knives.
That smell like chocolate. Yeah. Expand on that.
Yeah. So the Graston tools, again, it's just literally another tool that addresses the fascial adhesions, the muscle spasms. So fascia is like this like cellophane or cling wrap. When it gets tight, you have to really work to pull it apart. Well, adhesions develop in our muscles from overuse, from poor posture, repetitive motion. So much of what we can do is I can adjust the spine, and then when I go in and treat that fascia, we get more pain relief. And like you said, the goal is that they hold their adjustment longer. If I just adjust the spine and don't tackle that adhesions and those fascial releases, in my opinion, we can do more to minimize treatment office visits and time. Up here in the on the occiput and the C1, there's so much really crucial musculature that is really creating a lot of headaches and migraines. And so I love being able to treat both of those and get way better outcomes. But again, it comes down to like the provider. If I've had a patient that comes in and they've tried 5 other chiropractors who practice very similar to how I practice, but maybe they didn't get the Graston or the ART, or we do acupuncture, we do trigger point needling. So I don't want to keep doing what they've already done, And so really it comes down to the provider saying, what have you done? What worked? What didn't work? And every once in a while, Steph, you sent me a patient that had a medical file, like just pages and pages, that this poor woman had been everywhere. And I pulled up her MRI that she had on a CD, and I pulled it up, and her C2 vertebrae, so it's supposed to sit like this, and C1 sits around it, and it rotates like a donut around that C2. Her C2 seriously looked like this, like 45 degrees tilted. And I looked at her, I was like, girlfriend, I am so sorry. I need you to go to a different chiropractor who does upper cervical. So my friend down the road practices Atlas Orthogonal. And I said, I want you to start with her. And I thought my friend Maggie was just going to have to see her seriously like 100 times for how awful that C2 looked. And I got an email from that patient probably 3 weeks later and said, Maggie has changed my life. But in my professional opinion, there's no way I would have been able to get to that level of specificity that Dr. Maggie did because I just didn't practice that technique. So really, again, I think it really comes down to the provider to really look at the patient from the whole picture of saying, what is it that I think you need? And sometimes I'm wrong. Sometimes I have been humbled and underestimate the power of what I do. It's just a tool. I'm just a mechanic. The body is the healer. I just really work to put the tires rotated in the right spot. So there's times where I'm like, man, there is something crazy going on with this patient. And I just adjust the spine and maybe put 2 acupuncture needles in or do a little bit of soft tissue. And the patient says this was a game changer. And it humbles me just the power of when the body is aligned, when the nervous system is working. Just how sometimes the simplest of things, when we have super complex patients, can make a profound effect long-term.
Absolutely. So let's talk about some examples. You mentioned headaches that you have been able to help patients with. Let's talk about some other examples, maybe some unique cases. Like I know I had no idea about some of the techniques that you offered in your office until I started sending you patients, and I also started learning about how much you can help. So when I think of the Graston technique and its benefits, I think of patients who have tendonitis. So like golfers, if they have a golfer's elbow or tennis elbow, athletes, who have injuries or who have tendon issues, I think of your technique as being able to really break down scar tissue. Is that correct? Or fascia? You were just talking about fascia.
Yeah.
So can you, obviously this is not my forte, so can you expand on, for a listener, some complaints they may be having that these services, these techniques could help? So like tendonitis, carpal tunnel, plantar fasciitis, some of those things that these therapies could help that they may be totally unaware of and didn't realize how much they were missing out.
Yeah. Well, and two, I think sometimes even my own patients, they'll say, oh yeah, I've got this case of plantar fasciitis and I've been treating their headaches. And I said, hey, you never mentioned, that before. And they're like, yeah, because you're the back doctor. And some people, some chiropractors, they don't want to touch the feet. They don't want to deal with carpal tunnel. They just want to adjust their spine, and that's fine. But again, when we work so much, so plantar fascia, it's the bottom of the feet. In cadaver labs, we've literally been able to trace the fascia from the bottom of the feet through the back, up the Achilles, all the way up the hamstrings, all the way to the C1 vertebrae. That's just how much fascial connections. There's some pretty cool YouTube videos where they explain what fascia is. There was some woman that gave a TED talk, and she was a fascia expert, and she had this really cool bodysuit that she was able to pull the fascia up, and that just to be able to see, I don't know if you can see on my shirt here, like when you pull it and you twist it, that's what happens to fascia. And so how does fascia get tight? When we sit at our desk all day and doing this, the fascia and all the musculature, everyone starts sitting upright, but all of that fascia, it just tightens because we're in this position and posture all day long. This is also repetitive motion. We'll get tightening of the fascia along the back and the rhomboid to do one of these things, but then in front it just gets tighter and tighter. And so we can work with the techniques to be able to open up that fascia. So the bottom of the feet, I like treating plantar fascia because one, it's so debilitating. Two, it really does impact patients' gaits. So what I mean by that is they get up in the morning and their feet just ache and they kill, and they look like the Tin Man and Tin Woman getting out of bed. But it changes their gait and how they hunch down and their posturing. It's going to mess up their back long term. So I like treating plantar fascia. In the acute case, when it's brand new, meaning 0 to 3 months, usually we knock it out in about 3 to 6 visits. The chronic cases, we always aim for less is more, but some of those chronic cases take a multifactorial, more multifaceted approach just because they've had it for so long that we can't just focus on the feet, that we really have to include up the calf and Achilles into the hamstring. But we do a combination of the Graston, the ART, and then people hate it, the trigger point dry needling. I try to do that last to see if we can get everything else cleared out. But if I don't, I always apologize because it's not pleasant. I mean, it's one of the worst techniques that I hate to deliver, but I love the results it gets.
Yeah, they may hate it for 2 seconds, but then they love you 5 seconds later. Because
Yeah. And usually it's not 5 seconds later. I always tell them that the next day they might hate me and want to call me yelling in an email or through a text because they might feel way worse just with the feet and the biomechanics of the feet. And I can't tell a patient, hey, stay off your feet. So usually sometimes in the very first 24 hours, they absolutely hate me, but then follow the next day, they're like, holy cow, it starts to feel a lot better.
Well, I've just heard incredible testimonies. I haven't had that done on my feet. I've had it done, I think, on my pecs. Because I get so tight here from sitting like this.
Yeah. Well, and pecs feels a lot more pleasant compared to the feet. Yeah, I hope you don't have to come in for the plantar fascia.
I hope so too. I know I've had patients throughout the years have surgery scheduled for carpal tunnel syndrome, and I say, please just go see my friend. Please go see Dr. CJ. And they have canceled their surgeries. I mean, not that this therapy, we can't promise that is going to prevent everyone from, ever needing surgery, but I know these patients have been extremely thankful that before they went under the knife, they at least explored some other options, and you were very effective for them. So I thank you for that.
Yeah, well, and thank you. And I guess kind of to piggyback off that, back to the functional medicine realm, I mean, when we feel the hands and we can find the nerve entrapments, typically we'll know very quickly, like within that first visit, if we can recreate the very symptoms that they have, it means that we're on the right structure and the right anatomy that's creating the pinch and the hose. Think about it that way. I mean, anytime we've got carpal tunnel, there's a nerve being impinged. So what they do surgically is they go in and cut the fascia, so that the nerve can glide through there. And so our goal is that can we break through that fascia, you know, and we can have carpal tunnel symptom being trapped here all the way, you know, from the elbow to parts of like in the shoulder and the musculature here and here, all the way into the neck. But they might not have any pain, nerve pain here. The pain might just be in the back of the hand. So even sometimes just doing that action will really flare people up. Well, how do we type all day? It's in that action. So we can start by treating in the hand, but you know, good clinician, we're supposed to find it in the kinetic chain. However, back to the functional medicine and the thoughts, traumas, toxins, sometimes this is gluten intolerance.
Yeah, what's contributing to inflammation throughout the entire body? Likely something you're eating. Yeah.
This is undiagnosed autoimmunity, you know, when we can feel that there's just a lot of sticky swelling and inflammation in between the muscle bellies, that it's like, okay, we're not, and that's where it comes, is the patient willing and able to go down that route of exploring, you know,
right.
We use more diagnostic testing, or are we just going to go and create a surgery that'll give them relief? You know, a lot of the time it will.
But not get to the root cause of the problem, because that gluten they're eating could lead to an autoimmune condition. It could be also the cause of other symptoms they're having that they haven't put the dots together yet on. I think I mentioned earlier that I would get back to one thing that I appreciate about you is knowing when to refer patients out. And so you do send us a lot of patients when you say, hey, this patient's retaining a lot of fluid, something's going on. You may refer us a patient to explore if even something like a mold toxin could be contributing to them retaining this fluid. Or I know you send a lot of patients out to lymphatic drainage specialists to help the patient literally get rid of some of the fluid. So I think that's one of your office's strengths also, is that you know when to refer patients out, who to refer them to. I know you have 2 children, 2 beautiful, very blonde children. You can kind of see behind her in the pictures, actually.
They're a little bit older now. I should update them, but.
You had a very humbling experience with the birth of your second child, your son, that has taught you a lot in life, that lessons that you carry through your practice. So do you want to tell us just briefly kind of what that experience was like for you?
Yeah. I love to tell it because my firstborn daughter, her name is Porter, and she was born on leap day. So just a unique soul, literally from day one. And she started sleep, and I hate to admit this in front of like new moms, but she was sleeping through the night like at 2 weeks. And I just had this like glow of
my 14-month-old was awake.
I know, but I call it an innocent ignorance, because I had it and I was glowing with the innocent ignorance of, well, yeah, it's because she's getting chiropractic and she's getting breastfed and I'm the best mom and I'm doing all these worldly things right. And that's why she's sleeping through the night. And then, so here I am in my full on being great mom. 3 years later, my son comes, and he was born on January 1st. First baby of the new year. I have the weirdest birthdays for my kids, and the news always shows up. And they said, you just had the first baby of the year. Will you be on the news? Or you just had a leap day. And it's like, of all the times you want to be on the news, it's not after you've just had a baby. But yeah, so Cooper came on January 1st, and that child was hospitalized 5 times before his 6 months of life. And he was sick with all these respiratory viruses, and he wouldn't fever, which as a chiropractor, you're like, man, the fever is what kills the virus. So the fact that he wasn't fevering was really kind of messing with me, and it made no sense because I was doing everything even better than what I had done with my firstborn. And so I kind of think God humbled me with respect to, oh child, you can do everything right and health still not be. And, you know, it was the humbling reality of like, we're not in control. And Steph, I know you've seen patients that they're doing the work, they're doing the diligence, they're doing the labs, they're doing the supplements, they're changing the lifestyle, and we're not getting the outcomes. And it's frustrating. And I think that's when we have to remember like the true healer and the true power, what made the body heals the body. And so I needed that, my son Cooper's experience, to be humbled that you can do everything right and still go wildly wrong. But in short, he is healthy. I tell people he's piss and vinegar now, but it was really a humbling experience. We don't know why, but he was having massive kidney stones, which is very bizarre for babies and infants. He was clogging catheters because he had so many stones. But after that June visit down at the University of Iowa, we had a great experience and a great team there. It's kind of a miracle. We don't know what caused it and why it stopped, but I'm grateful. But I needed that. I needed to be humbled as a patient when you're so vulnerable for somebody to help you, that you'll do anything. But also, on the flip side of the realm of our own personal responsibility to take care of ourselves, eat a good diet, because I don't want to have to rely on the medical system again. Not that I don't trust it. I have a lot of faith in it, but just that level of vulnerability of when you feel so awful and so helpless, that it was a very uncomfortable feeling, but I needed to go through it. And I'm grateful that I had friends like you. There was a couple other friends in town that healthcare providers that I could lean on and text ideas and to help back find Cooper.
Yeah, well, thank God he is a healthy, adorable baby boy now. And I think what I love seeing not that I ever love to see a friend or a family member suffer, but what I do love to see come out of it is just how the appreciation that you have for the suffering and what has come out of that. And what now you can empathize differently with patients. But I'm mostly just happy to know that he is doing well. What is one thing that you cannot live with every day? Like what's something that's very important to you that you can't go without on the health spectrum? Like what is one of your healthy addictions?
I know that the addiction, you had sent me the email. You're like, what's the one thing that you do for longevity, or what's this? I'm like, man, Stephanie, my ADD I am not a pattern habitual person. My husband on the other side, like he has the same routine. He gets up in the morning, he goes to the bathroom, he washes his hand, brushes his teeth, and jumps in the shower. And like, he does it in a very like orderly pattern. And I am so not like that. So to answer the question, what is the one thing I do daily, is probably, I don't do the same thing every day.
Or even, I should have said, or weekly. What's something that you do weekly for yourself?
Yeah. I mean, I think, and again, this is just maybe the current moment, but the prayer, the meditation,
yes,
daily, weekly. I mean, it might not be as long as it should, but it's definitely there in the daily routine. But I'm big on journaling and goal setting.
Yeah.
I think in realms of longevity, we all need to know what we're working on and towards.
Whenever we're at a conference or whatnot, I know you always have your book or in your purse. You're always writing things down, and goals are like 90% more likely to be accomplished if you write them down. So that's partially why you've accomplished so much, because you're writing them down. So audience, listeners, take that to heart. What's something
Stephanie, let me ask you, what's yours? What is one thing that you can't live without, or that's part of your routine?
You probably wouldn't like my answer. When I think of one thing I couldn't live without, I immediately want to say air conditioning, because I'm always so warm. I need air conditioning. Yeah. Well, I'll say this because of the next question that I was going to ask you. Something that you do daily to support your immune system. I am pretty habitual about my supplements. That's just part of my routine. So something that I do every single morning is I wake up. If William's not up, I go out to the kitchen and I'm taking my supplements. So right now, silver is something that I love taking. I usually take it through flu season. I was kind of lax. I kind of laxed on it January, February, but then in March started taking it again. So I am fully habitual about taking my supplements. Like if I don't take them, it causes anxiety. That is something that I do daily. But I think prayer and meditation is more important than taking the supplements. So that's something also, especially as I'm feeding William and rocking him to sleep at night, that's kind of my prayer time. Pray over him, pray over, business and family. And that's the time that I have right now to do that. So that's also part of my routine. But what do you do to support your immune system? Or what is a tip for the viewers, the listeners on immune support?
Yeah. So,
because I just said that. No.
No, one of the things that I feel really passionately about, especially with what you and I are seeing just in our patients, movement.
Yeah.
And sweating. Our bodies were meant to move. We weren't meant to sit at a desk all day and sit at computers. We were meant to move. And I think that movement, from a longevity standpoint, I mean, it circulates the blood, it cleanses the blood, sweat detoxes the body. So it doesn't have to be a crazy cardio workout every single day, but getting strong, maintaining strong. So I'm a big, firm believer, if we're not moving, if we're not working out and sweating at least 20 to 30 minutes, 4 to 5 days a week, we're doing harm. and it doesn't cost anything. We can all do it with YouTube. And I mean, there is so much free information out there, literally at our fingertips, thanks to technology, that we have no excuse not to move. But even just like the mindful motions of yoga, and there's Tai Chi and Qigong, and even just something as simple as like bouncing on like those little trampolines, just to get the body moving and from an energy standpoint. So I'm a big believer in that. And thankfully, it was hard when, I think, as working mom, Stephanie, and you'd probably agree, that the workouts, especially after you have a kid, then you're having to nurse them and then pump, or if you're not pumping, then you're changing diapers or doing laundry, and then you want to shower yourself, that like the whole time to work out, you have to either be really, really diligent. And I did, I fell off the wagon, working out with probably 4 or 5 years of, from the time that I got pregnant with my daughter till my son was having his second birthday, workouts were not consistent and not part of it. And now it's not about being fit for me, the working out, it's about the mental clarity that it gives me to burn off the adrenaline and get clear in my head for the day.
Yep. I totally agree. I used to go to yoga, and through my pregnancy, I went to yoga. I needed that so bad. And I have really laxed on that. And recently especially with everything being closed, yes, you can access it online. So I just said, okay, William, we're doing yoga today. And we were in the basement, and he was laughing at me and kind of looking at me and making faces like, like, what are you doing, Mom?
Yeah.
I just stretched, and I let him kind of climb all over me. I got some yoga, and of course it wasn't the most relaxing practice, but we were laughing together. It was a fun experience, not experiment, although it was an experiment, fun experience. And, and that just kind of motivated me to think there's no reason why I can't be doing this every week. And so that's something that I'm speaking out loud that I'm going to start incorporating again. And he's at the age now where I can leave and go to yoga. So when everything opens up, I look forward to getting back into that. But I love that your tip, movement. I'm going to take that as your top longevity tip, which is wonderful. So where can viewers find you? Social media, website?
So that's funny. My practice is called Back in Line Chiropractic. We're located in Hiawatha, Iowa, which is right next to Cedar Rapids in your practice. We also have a website called My Well Labs, that we have a supplement line similar to Longevity Blueprint. And
those are your websites, and you're on social media. Your businesses are on social media as well.
Yep. Yeah.
What are those 2 websites then?
From the Instagram?
Or what are your websites? So My Back in Line.
I'm sorry. Yeah, mybackinline.com, and then mywelllabs.com.
Wonderful.
And there's I don't even remember, like Instagram might be at My Back in Line. I'm not even sure. It's embarrassing that I don't know that. You can follow my personal page, which I mix personal and professional all the time. I have no boundaries. That might be a problem. I don't know.
I'll get all those links from you, and we'll post all of that in the show notes. So please follow Dr. CJ Kleene on all of her social media accounts. CJ, this has been a total joy, and I hope viewers do realize they are likely missing out on the benefits of chiropractic care, and that they truly may not know how good they could feel if they can find and select a wonderful, good fit chiropractor for their health. So thank you so much for always supporting me, and thank you for your smile and the joy that you bring to all your patients and your just contribution to this world. So thank you for being on as a guest today.
Thank you for having me.